Hello students, I am Rani, Assistant Professor, Vinayaga Mission Research Foundation, School of Allied Health Science, Salem. My topic today is spinal cord. We are studying spinal cord in detail today. You can see the picture, two pictures are there. One is the longitudinal section of the spinal cord and the another one is the CS section of the spinal cord. You can see the entire spinal cord here in the first picture. That is from the lower base of the brain till up to the coccyx vertebrae down. Okay, then next you can see the cross section, that is the inner structure or the internal structure, that is our outer white matter and inner gray matter and the spinal nerves which are arising. All these structures you can see. So from this picture you can analyze that the first one is the longitudinal section. We can say it as the external features of the spinal cord, and where the other one is the cross sectional features of the spinal cord, which means the internal structure of the spinal cord. Now as anatomy we are studying all the structures, whatever we are studying, we should know where it is present, what is its shape, then from where to where it extends, like that. So the same thing we study in spinal cord also. We all know spinal cord is the part of the central nervous system. Central nervous system means brain and the spinal cord. So the spinal cord, it is the extension of brain stem. The lower part of the brain stem is called as a medulla. From there it extends and it comes down up to the coccygeal vertebrae. So the shape, as it is an elongated structure, we used to say it as a cylindrical structure. Then measurements, it varies from textbook to textbook. Measurements will be different. Other also it differs, but somewhat approximate measurement we used to study in anatomy. So that is, it little varies from male and female. That is 45 centimeter for male and 42 centimeter for female. And the weight also somewhat approximate weight for anatomical structures we used to say. Here it is we referred like that is 30 grams. Then extension. As we all know, from the base of the brain the vertebral column starts. Vertebral column means the first cervical vertebrae to the lower coccygeal vertebrae, C1 to CO4. Okay, so we can say it as, it is written here that it is extends from the first cervical vertebrae to the spinal cord, it extends up to the first lumbar vertebrae. Now you should know what are the parts of the vertebrae in region wise. So first one, at the neck region, cervical vertebrae, there will be 7, then thoracic vertebrae 12, lumbar vertebrae 5, sacral vertebrae 5 and coccygeal vertebrae 4. So here the extension we are saying as from C1, first cervical vertebrae to the first lumbar vertebrae. Below that it is spinal cord, which is arranged as nerves only, but we will say up to L1. Then below that L1 we used to say it as conus medullaris. Actually conus medullaris means the lower tapering end of the spinal cord. Both brain and spinal cord, which is covered by some coverings. So all the organs we are having, just like heart is covered by pericardium, lungs is covered by pleura, just like that, brain and spinal cord is also covered by some layers. That common term we used it as meninges. For brain and spinal cord, there are 3 layers or 3 meninges are there that are called as dura mater. Here in the picture you can see outer dura mater, middle arachnoid mater and innermost one is pia mater. 3 layers will be there. So we will say, for as we are studying spinal cord today, we are saying spinal meninges. Last topic we said extension of spinal cord is up to L1, but for the meninges it comes little down. Here see, here after lumbar, sacral also the meninges will cover. So that's why it is written as extend from foramen magnum. That is C1 starts at the foramen magnum, C1 to S2. Then there will be spinal cord, outer covering is called as the vertebrae. All the vertebrae together we will say it as vertebral column. So the space between the vertebral column and the spinal cord or the dura mater, outermost covering dura mater, we will say it as epidural space. That is the space between the spinal dura mater and the vertebral column. Actually, vertebral column, vertebrae is a bone. Bone is covered by periosteum. More specifically, if you are saying, means from the periosteum of the vertebrae to the spinal dura mater. So it consisting of fat, then some venous plexus will be there, then areolar tissues will be there. So these spinal meninges means the three layers, that is the outer dura mater, middle arachnoid mater and the innermost pia mater. The same thing it is written here as to understand it more clearly. You can see the outermost skin is there, then aponeurosis, then you can see bone, whatever skull or vertebrae. You can see it as periosteum, bone, then comes the meninges. So the dura mater, arachnoid mater, pia mater, then it comes into the substance where if it is in the cranial cavity, that is the brain. If it is for the vertebral column, we will say it as spinal cord. Next, as we are medical students, we should not say only the coverings, that is dura mater, arachnoid mater or pia mater. You should know even more about these layers. So dura mater, as it is a layer, again it is divided into two layers, that is periosteal layer and meningeal layer. Example to know, revise, that is pericardium, we will say it as serous pericardium, fibrous pericardium. Pleura, visceral pleura, parietal pleura. Just like that, for the dura mater, it is having an outer layer. Dura mater is actually, it is two layers. So it is outer periosteal layer which is in contact with or touch with the bone, periosteum. Then meningeal layer which is in contact with the next layer of meninges. The two layers are fused almost, it is always, it is fused. Fused means it is attached. It is not, it doesn't have space in between. But where the venous veins of the cranial cavity comes or the spinal cord comes, we used to say it as dural venous sinus. At the region only, the outer and the meningeal layer, outer periosteal layer and the meningeal layer will be separate. Then next arachnoid matter, then pia mater, which is the innermost layer. As it is most innermost layer, it is actually, it will be delicate. Then dura mater as it is outer layer means it gives protection to the organs. So dura mater, for the spinal cord it is not there. For the brain, the dura mater will fold inside the spaces between the cranial cavity. That we will say it as folds of the dura mater. Actually, not the periosteal layer, the meningeal layer of the dura mater which folds inwards or turns inside and separates the organs inside the cranial cavity. So that is written here as falx cerebri, tentorium cerebelli. Here in this picture you can see falx cerebri. Cerebri means cerebrum, that is it separates the two cerebral hemisphere. It separates the two cerebral hemisphere. It is a sickle shape. Can you see this picture? It is almost just like a weapon, that is sickle. Just like that you can see. So in one side, left side cerebrum is there, cerebral hemisphere, right side cerebral hemisphere will be there, and the falx cerebri lies over there. So it separates the two cerebral hemispheres. Then its attachment is also there. Anterior it is attached and posterior it is attachment. Superior it is attached to the bones, but inferior it will be free. So it lies in between the cerebral hemisphere. Between the cerebral hemisphere, what will be there? That is the median longitudinal fissure. So you can say it as the falx cerebri, which is the fold of meningeal layer of dura mater, which lies in the median longitudinal fissure, which separates the two cerebral hemisphere. Next, tentorium cerebelli. You can see falx cerebri here. Then this is the tentorium cerebelli. That is cerebelli, which is related to cerebellum. So as the picture itself, you can see above the tentorium cerebelli, we can see the cerebrum, and below the tentorium cerebelli we can see the cerebellum. So the tentorium cerebelli separates the cerebrum and the cerebellum. These are the folds of dura mater which separates the organs. Then arachnoid matter, before that, that's a second layer, that is, it is soft and translucent membrane which envelops the brain. It is having a space that is called as subdural space. Subdural space is nothing but dura mater. Below that, one space is there, then the arachnoid matter will comes. So the space between the dura mater and the arachnoid matter, we will say it as subdural space. So two spaces now we have studied, that is epidural space and subdural space. Epidural space is a space between the periosteum of the vertebrae and the dura mater. Then now we study subdural. Sub, the word meaning, literal meaning itself is below the dura mater. That is called as subdural space, below the dura mater, above the arachnoid matter, or in between the dura mater and arachnoid matter. Then next one is pia mater, the innermost layer. Innermost layer, it is highly vascular. It is delicate, thin, highly vascular. It is having rich blood supply. Everything else will be there, and it is in direct contact with the cerebrum. So this cerebrum and the pia mater all together, we will say it as the innermost layer. Then the space between the pia mater and the arachnoid matter, we will say it as subarachnoid space. So next, third space, it is subarachnoid space, that is below the arachnoid space, which contains CSF. So CSF, for your information or your revision, that is pia mater is consisting of numerous highly vascular blood vessels, we said. So these blood vessels, we will say it as choroid plexus. This choroid plexus produces CSF. CSF, which will be produced from the choroid plexus, which is present inside the pia mater, and it is drained into the subarachnoid space. So CSF, it is a fluid that lubricates the brain and the spinal cord, which is present inside the subarachnoid space. The space, subarachnoid space, is a space between pia mater and arachnoid matter. Then in this subarachnoid space contains CSF, which is produced from the blood vessels present inside the pia mater, that is called as choroid plexus. The short revision of all these things what we studied now only, that is the meningeal spaces, epidural space, subdural space and subarachnoid space. So from this picture you can see these, that is epidural space, that is the space between the bone and the periosteal layer of the dura mater. Subdural space, that is, it is a space between the dura mater and arachnoid matter. Then subarachnoid space, it is a space between the arachnoid matter and pia mater. Spinal meninges, which have some modifications. All the structures that what we are studying it in detail, some elongations or modifications, the same meaning only it is having, will be there. So the modification or the elongation of pia mater, some accessory structures are there in the spinal cord. These are called as linea splendens, ligamentum denticulatum is there, and cerebral cistern is there. Linea splendens is nothing but it is a white glistening structure that extending throughout the spinal cord, starting from the cervical vertebrae C1 to down L1. It is present inside the anterior median fissure. Okay, that anterior median fissure we will learn in detail later. Same way, ligamentum denticulatum is also, while studying the surface of the spinal cord, we will study. Next one is phylum terminale. Here in this picture you can see the conus medullaris, that is at the level of L1. From down you can see phylum terminale till up to the first coccygeal vertebrae. There are 4 coccygeal vertebrae are there, but the final as phylum terminale extends up to the first coccygeal vertebrae. That is, actually it is all made up of nerves, but in the center, directly at the center or it at the median plane, we can see a small thread-like non-nervous fibers are there extending from conus medullaris till up to the coccyx 1. That is called as phylum terminate. So the description it is here. It is a white glistening delicate thread-like structure extending from the tip of the conus medullaris to the first coccygeal vertebrae. See, it is specifically, you should note this, it is a non-nervous fibrous tissue, but it is having few nerve fibers also, but actually it is non-nervous. Then central canal of the spinal cord extending up to the upper part of the phylum terminate. Then here ligamentum genticulatum, it is also another extension of pia mater outside the spinal cord, that is ligamentum genticulatum. Actually it is a ribbon-like, hook-like, tooth-like structure. There will be 21 spine-like, hook-like structure we can see towards the lateral side of the spinal cord. That is called as ligamentum genticulatum. So it starts from the foramen magnum, actually foramen magnum or C1 you can say, first cervical vertebrae till up to L1. It varies from person to person, that is T12 also it can stop or L1 till up to where the spinal cord ends. We can see towards the lateral side or on either side, right and left side, you can see a thick hook-like or tooth-like structure in the spinal cord, that is called as ligamentum genticulatum. It is actually 21 in number. It is actually the extension of inner pia mater towards outside. It pierces the arachnoid mater, dura mater, and it comes outside, and it is expressed as a tooth-like structure, and that is called as ligamentum genticulatum or denticulata. This one is the external features of spinal cord. You can see a cross section. Here you can see here where the arrow is there, this is the anterior part of the spinal cord, and the other side this is the posterior part. How you can recognize this is, here in the anterior part you can see a deep furrow, that we will say it as fissure, but at the posterior part we can see just a small downward prolongation, that is called as a sulcus. So this furrow or anterior region fissure, we will say it as anterior median fissure, and outside in the back side or the posterior we will say it as posterior median sulcus. It is not that much deep, so we will say it as sulcus. So this is anterior and this is posterior. Then we all know spinal nerves are arising from the sides of the spinal cord. So you can see two more sulcus is present. So we can see fissures, sulcus. So two more sulcus are there. From the sulcus only the spinal nerves are arising. So the spinal nerves, can you see this spinal nerve? Spinal nerve, it is not just a nerve arising. Two roots are arising, then it joins and it forms one spinal nerve. So the roots we will say it as anterior root and posterior root of the spinal cord. So where the anterior root arises, we can see one sulcus, that is called as anterolateral sulcus. Where the posterior root arises, we will say it as posterolateral sulcus. So we can see three sulcus in a spinal cord. Posterior you can see a sulcus, that is called as posteromedian sulcus. Here in the posterior towards lateral, so we will say it as posterolateral sulcus, where the posterior root of the spinal cord arises, and anterior, not lateral, in between. So we will say it as anterolateral sulcus, where the anterior root of the spinal nerve is arising. Then, so the attachment of spinal cord. Then the fissure, I said only one fissure is there, that is called as anteromedian fissure. Three sulcuses are there, I said posteromedian sulcus, posterolateral sulcus, then anterolateral sulcus. Then I said chorda equina and enlargements. That also we will see from the picture. Here below the L1 actually for a lumbar vertebrae L1. You can imagine that also as lumbar spinal nerve. Below that also spinal nerves are there, L2, L3, L4, L5, S1 to S5 and coccyx 1. These spinal nerves forms a tail-like structure. just like a tail-like structure, that is called as chorda equina. Chorda is, from the word meaning itself, we can say it as the last part. Equina, it is a scientific name of a hose. Equina, something else is there, but equina is also there. So this part is seems just like that of the tail of a hose. So below the L1, the spinal nerves are arranged just like that of a wavy hair, just like that of a tail of a hose. So that region we will say it as chorda equina. So that is what it is written, chorda equina. Chorda equina, it is nothing but the nerve fibers, spinal nerve fibers starting from L2 to L5, S1 to S5 and CO, coccyx 1. These forms chorda equina. Then the last one that we want to know is enlargements. There are two enlargements will be there. One is cervical enlargement and the another one is called as lumbar enlargement. You can see the picture here. Cervical enlargement, then lumbar enlargement, we will see the picture and then say this one we have said anterior surface, anteromedian fissure, anterolateral sulcus. Two anterolateral sulci, it is written as, means what I said is towards one part, right or left side. So the other part is also will be there. So two sulci will be there. Then posterior also, posterolateral sulcus and posterior median sulci. Then the two roots are arising. Then about the spinal nerves. Spinal nerves, the bones, cervical bones are 33 in number. Cervical 7, thoracic down, thoracic that is 12, lumbar 5, sacral 5, coccyx 4. Through all these we can see the spinal cord. So from the spinal cord, cervical region, one more segment will be there. 8 spinal nerves are arising, 12 thoracic spinal nerves are arising, 5 lumbar spinal nerves are arising, 5 sacral spinal nerves are arising and 1 coccygeal spinal nerves are arising. Then this one also I have said, that is 2 roots are arising, one will be motor and another one will be sensory. That is 2 roots, anterior motor root, posterior sensory root. This one, posterior sensory root and anterior motor root. Here you can see in this picture, that is anterior or ventral median fissure, dorsal median sulcus or posterior median sulcus. Then where the nerve roots are arising, there we can see anterolateral and posterolateral sulcus. The 2 roots, ventral root or anterior root, dorsal root or the posterior root is arising. The spinal segments, here also I said, since the number of spinal segments corresponding to the vertebrae in thoracic, lumbar and sacral are the same, as the number of spinal segment 12, spinal nerves arising is also the same. But the change is 1 extra for the cervical vertebrae, cervical region, that is 8 cervical spinal nerves are there, but the segment will be 7. Same as coccygeal, 4 segments are there, but 3, only 1 spinal nerves are arising. Enlargements, the one thing we missed, that is the enlargement. That time I said it is the cervical enlargement and lumbar enlargement. Cervical, from the name itself, the region you can locate, that is at the neck region. So cervical enlargement, it is produced by the cervical spinal nerve C5, 5th cervical spinal nerve to T1, that is first thoracic spinal nerve. Then these, what does it gives or what does it produces or what does it makes, means it forms brachial plexus. You all know that brachial plexus. Brachial plexus is formed from C5 to T1 spinal nerve, ventral rami of spinal nerves. So these produces nerves which goes to the upper limb. Then pectoral girdle. Pectoral girdle means towards the axillary region or the shoulder joint region. There, which are the nerves present or it innervates or present, that is arising from the cervical enlargement, which produces a plexus that is called as brachial plexus. Then the same way lumbar enlargement. Lumbar enlargement, it is a little different. That is, in some textbook it will be said as lumbosacral. So both lumbar and sacral. So the spinal nerves arising from L2 to S3, second lumbar vertebrae, to the third sacral vertebrae, to T9 to L1. All these produces lumbar enlargements, which produces nerves which supplies the muscles of lower limb and pelvic girdle. Here above it is girdle, it is written as pectoral girdle. Here it is pelvic girdle. Then chorda equina, the same thing I have said here, that is below the conus medullaris, all the nerve fibers which will be just like that of a tail of a horse, that is the nerve fibers from L2 to L5, S1 to S5 and CO, coccyx 1. All these forms are chorda equina. So it consisting of this 4 pairs of lumbar spinal nerves, 5 pairs of sacral spinal nerves and 1 pair of coccygeal spinal nerve. Then as anatomy is concerned, whatever organs or whichever location we will study arterial supply, venous drainage and nerve supply. Since spinal cord, it is consisting of all the nerve fibers, we are not saying about the spinal nerve supply, because all the spinal nerves which supplies the region. So we doesn't care for that, but we should know about the arterial supply and venous drainage. Arterial supply, here it is written as anterior spinal artery, posterior spinal artery and segmental artery. Do you have ever heard about anterior spinal nerve artery and posterior spinal artery? It is a branch of vertebral artery. If you are studying the blood supply of the brain, you can say vertebral artery. You will come across vertebral artery. Vertebral artery is the first branch of subclavian artery. Subclavian artery arising from arch of aorta. So from arch of aorta or from the heart, I will say that is as a aorta. Aorta, it is having a part that is called as arch of aorta. From the arch of aorta, subclavian artery is arising. Subclavian artery's first branch is called as vertebral artery. It ascends upwards through the foramen transversorium of cervical vertebrae from C6 to C1. It ascends up, then it joins and goes inside the cranial cavity. Before it goes inside the cranial cavity, it gives these branches, that is anterior spinal artery and posterior spinal artery, which supplies the anterior and the posterior aspect of the spinal cord. Then next one, segmental artery, small fine branches will be there which supplies a respective region. Then next one, venous drainage. As the blood goes, gives nutrition, oxygen, the waste material, then the carbon dioxide should come out. That is through venous drainage. So there will be 2 veins will be there, that is median longitudinal vein, then anterolateral vein, posterolateral veins will be there. So we studied about the external aspect, internal aspect, the elongation or the specifications of the coverings, then next arterial supply, nerve supply, then some clinical aspects should also be there. So first one will be anterior spinal artery syndrome, that is occlusion or the enlargement of anterior spinal artery is one defective condition which produces motor symptoms, that is the involvement of corticospinal tract. Spinal cord consisting of so many tracts which carries all the sensations. So corticospinal tract will be affected. Then next one, bilateral loss of pain and temperature sensation. Pain and temperature sensations will be lost as it affects spinothalamic tract. Then next one, spina bifida. You all know that it is a congenital anomaly. That's why baby's picture will be there. That is congenital anomaly where the spinal cord or the spinal matters will come out through the opening of the vertebrae. So it is stage wise, it is divided as spina bifida occluta, that is the first stage. Second one, meningocele, and the last stage where myelomeningocele. It is nothing but just the spinal region will be affected. Vertebral region where the spinal nerves are there, that region will be affected. The first stage is called as spina bifida occlusa. Then when some fluid will come out, fluid or pus will come out through the vertebral opening, that we will say it as meningocele. When along with the fluid, the spinal nerve or the content will come out. Along with spinal nerve, it is coming out. That condition is called as myelomeningocele. So this is spina bifida, that is one single language, that is the spinal cord or the content inside will come out, that or it will produces some defect at the vertebral opening that cause spina bifida. So according to the level, it is called as spina bifida, meningocele, myelomeningocele. Then the last and the most popular one, that is called as lumbar puncture, that is it is done at the level of L3 and L4. Since L3 and L4, the nerve fibers will be scattered. As I have said, quadra equina is the region where the nerve fibers will be scattered. So we can aspirate through the region L3 and L4 to aspirate, and we can take out cerebrospinal fluid, and that procedure is called as lumbar puncture. The region is in between L3 and L4. Why? Because above the L3, that is L1 onwards, above the spinal nerves will be somewhat, it is attached. We cannot give sensations there, or we cannot irritate that region. But below the region quadra equina, we can see at the region of quadra equina, we can take or we can aspirate CSF. And most probably it will, the region we will take is between the L3 and L4. There are some conditions where L2 and L3 also will be preferred, but most common preferred site is L3 and L4. So these are the applied aspect: lumbar puncture, spina bifida, and then anterior spinal artery syndrome where the nerve tracts will be affected and their sensations will be lost. All these things comprises the spinal cord topic for UG students. Thank you. These are the important points for a better knowing of learning of spinal cord. Hope you all understood and have a good time learning spinal cord. Thank you.